various channels like Telegram or WhatsApp and Quora. Hello. So we sorry, there is some internet error. So ma'am is now pursuing her PhD from the Gadwasu in the research area canine hematology and blood banking. Recently, we have shared uh, Google Form on our various social handles. There we are giving the opportunities to the students so they can propose a topic themselves and then present in front of you regarding the different topic. And ma'am has presented a very unique idea that is a blood banking, and she has prepared a very nice presentation, and she will be sharing her experiences, what she is doing during her PhD. So let it over to the ma'am. Ma'am, now you can.
Uh, Good afternoon, everyone. My name is Dr. Iqra Shafi Khan. I have completed my BVSc from SCOST-K, my master's and PhD from Gadwasu. So I thank Veticos Advance for giving me opportunity to present this webinar that will be beneficial to all the students of veterinary who are interested in blood banking, especially in the component therapy, that is the advancement. So we'll start, I guess we'll start in next 3 minutes. Is it okay that we start in next 3 minutes?
Ma'am, I think now you can start.
Hello? 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 Am I audible? Okay, shall I start? So the topic is advancement in canine and feline transfusion medicine and an introduction to the blood banking in veterinary medicine. So starting with the basic information, so blood transfusion is an integral part of life saving in canines and felines. So it is the intravenous therapy of blood or its components in dogs. So the blood can be given as whole blood, fresh blood, stored blood, as well as the components like plasma, platelets, as fresh frozen plasma, can be administered in dogs. So Richard Lover in 1665 introduced the concept of transfusion, where he exsanguinated a dog and transfused from his jugular vein to the cervical arteries of two mastiffs. So after that, the animal to animal transfusion started, human to animal transfusion started. So transfusions like xenotransfusion started, so that it can be used for day-to-day basis. So transfusion therapy is the mainstay therapy as a supportive treatment for anemia as well as thrombocytopenia in dogs. So the clinical signs of anemic patients include the pale mucous membranes, exercise intolerance, they are weak, they are tachypnic, they are tachycardic, and they are hypotensive, that is consistent with a hemorrhagic shock in these patients. So you can see in this picture the pale conjunctival mucous membrane of a dog, as well as on the right hand side you can see the petechial hemorrhage due to thrombocytopenia. So coming to the
Ma'am,
transfusion, before coming to
excuse
the
me, ma'am.
trans, yes,
Ma'am, kindly put your PPT in Slideshare mode and your slides are not changing.
it's already in I guess slideshow mode.
No, ma'am.
If you can see, is it in slideshare mode?
Ma'am, you have you need to go to the slideshow because we are able to see your full screen, not a particular slide, ma'am.
Is it still the same?
Yes, it is same, ma'am. Pictures are not clear.
Ma'am, you are presenting the entire screen or entire tab.
I guess I'm presenting the entire screen.
Okay, ma'am. Uh, if you need to present an entire screen, then put the slide in the slide
Should I
from the
put it in as entire screen or as a window?
entire screen. If you put in entire window, then we are not able to see the slide.
If you are able to see now, okay, fine.
Yes, ma'am. Now it is clear.
Okay. Shall I start from the beginning or shall I start from the point I am currently?
Ma'am, you can start from the beginning if
Okay,
you are
fine.
convenient.
Blood transfusion is an integral part of life saving in canines and felines. Richard Lover in 1665 transfused the blood in a dog for the first time. He accentuated a dog from which he connected his jugular vein to the cervical arteries of two mastiffs and used the transfusion for the first time. After that, the human to human transfusion, animal to animal transfusion, or xenotransfusions were practiced so that it could serve as a standard for the transfusion. So, the transfusion therapy is a mainstay as a supportive emergency treatment for anemia as well as thrombocytopenia. The clinical signs of anemic patients are pale mucous membranes, exercise intolerance, they are weak, they are tachypneic, and they are tachycardic, and they can be potentially hypotensive. That is consistent with a hemorrhagic shock. So coming to the picture, if you can see on the right hand side, we see a patient who has thrombocytopenia, and on the left hand side we can see a patient with a white conjunctival mucous membrane. So these are the particular signs of anemia and thrombocytopenia in dogs. So before going to the transfusion medicine, we should know about the concept of anemia. So whether the anemia is regenerative or non-regenerative. It is dependent on the reticulocyte count of a patient that is performed particularly on methylene blue slide. The reticulocyte count should be greater than 80,000 in dogs if we are saying the anemia is regenerative. For the cats, it should be greater than 60,000 to be a regenerative anemia. What does regenerative anemia mean? Regenerative anemia means that the bone marrow is responding to the blood loss in the patient. So the regenerative anemia usually occurs, if you can see on the flow chart on the left hand side, it can occur due to hemolysis or hemorrhage. So hemolysis can be intravascular hemolysis as well as extravascular lysis, as well as hemorrhage can be external as well as internal. So these type of hemolytic or hemorrhagic anemia, they are usually regenerative anemia, and the causes can be mechanical injury to the RBCs, hemoprotozoal diseases, immune mediated diseases, or it can be abnormal RBC enzymes, or it can be abnormal RBC states. So coming to the right hand side, the non-regenerative anemia, in which if we check on the smear with methylene blue slide, so the reticulocyte count is less than 80,000. So the major diseases that are responsible for the non-regenerative anemias are either it can be to reduced RBC production, or it can be due to reduced erythropoietic factors. We all know that the erythropoietin is produced from the kidneys. So when there is reduced erythropoietin in chronic kidney disease, the anemia is usually non-regenerative, while as the diseases of bone marrow that are aplasia, myelofibrosis, or myelofibrosis, they also cause a non-regenerative anemia in dogs. So coming to the canine blood groups. So this is very important, canine blood groups. Currently we have 13 canine blood groups in which we have DEA 1.1, DEA 3, DEA 4, DEA 5, DEA 7. However, in the recent years, there has been discovery of these antigens like DAL that has been attributed to the Dalmatian breeds. However, currently what we have seen that it's also present in the other breeds like Lhasa, Doberman Pinscher. They also have DAL type of blood group, and other blood groups are Chi1 and Chi2. So what the blood groups that are important to us are DAE 1.1 and DAE 1.2, that are most important clinically in dogs, while as DAE 1.1, DAE 1.2 and 7, they are the most antigenic blood types. So we have this blood typing cards that are commercially available that are used for the typing of blood. As you can see in this picture, there is a cab dog blood typing card, in which we use a one drop of blood, and we use a one drop of buffer, or we can use one drop of normal saline, and we check the blood group of dog. So this dog is DEA 1.1 positive, and it on the other side, this is a control group. That means this card is working safe. So when it comes to the donor testing, the DA negative 1, DA negative 3, DA negative 5, and DA negative 7, they have the safest blood in terms of RBC antigens. So coming to the feline blood groups, in felines we have three blood groups, that is A, B, and AB. While as type A is the most common, type B is having a strong inherent antigenicity against type A, while the type A is weakly antigenic for type B. So there is a newly discovered blood group, that is MIC in cats. So we can see in picture the rapid wet etch cards, in which the picture shows in where there is type A blood group in one patient and type B blood group in another feline patients. So coming to the indications of transfusion. The indications of transfusion are when the hematocrit falls below 20% in dogs and 12% in felines, the transfusion is indicated. So the transfusion can be indicated in the deficiency of blood constituents and the diseases like IMHA, immune-mediated hemolytic anemia, in case of surgery, in case of babesiosis, in case of pulmonary hemorrhages, in case of diseases like chronic kidney diseases, chronic liver diseases, in case of thrombocytopenia, in case of DIC, disseminated intravascular coagulation, as well as in patients with trauma. So they may need the immediate blood transfusion to save their lives. So coming to the what is the criteria for the selection of donor. So donor should have a friendly temperament, it should have an age of 1 to 8 years, and the most important is that it should have a hemoglobin greater than 13% and PCV greater than 40%. So an adult animal with a good body condition and a good body size weighing 25 kgs or above is a suitable donor. So it should have a no history of blood transfusion or pregnancy, because the pregnancy predisposes the dog to the stress as well as stress to the fetuses. It should be negative for hemoprotozoa and Babesia canis, Brucella canis on RVPT. The maximal volume that the dog can donate is it can donate up to 20 ml of blood per kg body weight, or a regular blood bag unit contains 450 ml of blood per 25 kg of dog. So if we look into this, that if the estimated blood volume of a dog is zero point 0.8 to zero point 0.9, so what we do, if a dog has a weight of 20 kgs, we calculate it as 0.08 into its body weight. So if a dog has a body weight of 20 kgs, so we can multiply 0.08 into 20. That comes the total blood in the liters that is present in a donor. So coming to the next thing that is very important, that is cross matching. So what is difference between cross matching and blood typing? So what happens, the blood typing, it reveals the blood group antigen on the red blood cell surface, while as blood cross matching tests the serological compatibility between the donor as well as the recipient. Thus the cross match test checks for the presence or absence of naturally or occurring or induced alloantibodies in the serum or plasma of a dog without determining the blood type, and thus the cross matching does not replace blood typing in dogs. So coming to how we perform the cross match in dogs, so there are usually two match that are done. First is major cross match and second is the minor cross match. What we do in major cross match, we take the donor blood and the recipient plasma. So what we do, we centrifuge the blood, both of the donor as well as recipient, for 2000 rpm for 3 minutes, and after that what we discard the supernatant from the donor blood and wash it 3 times with the normal saline, And what we do next is we put a drop of recipient plasma and the donor blood on a slide and check for macro as well as micro agglutination on the slide. So the minor cross match is opposite to that, in which we take the recipient blood and match it with the donor plasma. So the macro agglutination is incompatible, while as the micro agglutination, if absent, is compatible. So I'll be showing you the two photographs of compatible blood groups as well as incompatible cross matching. So on the right hand side, you can see an incompatible cross match, that is major cross match, where you can see the clumping of RBCs together. While as on the left hand side, you can see a compatible cross match, that is we can see the RBCs, they are separated from each other in this slide. So if we talk about the compatibility, the first picture is compatible, so it can be safely transfused, while as the second picture is incompatible cross match in a dog. So coming to the anticoagulant preservative solutions. So when we collect blood, so we put it in a bag, commercially available bag that contains CPDA1 as an anticoagulant. However, substances like heparin, sodium citrate, ACD, they are also available as anticoagulant preservative solutions, and they have a particular shelf life. For example, heparin, it can be only used for immediate transfusion because the blood cannot be stored in heparin. It is an anticoagulant, while the heparin is not as an RBC preservative. When coming to the sodium citrate, the blood can be safely stored in sodium citrate for at least 21 days. When coming to the ACD, the blood can be safely stored in ACD for 21 days. While when coming to the CPDA, the blood can be stored for 28 days, and same for the CPDA. So what is advancement is that we have CPDA plus SAGM, that is saline adenine glucose mannitol, that gives back a shelf life of 42 days. So the commercially available blood bags contain CPDA1 as an anticoagulant. So these solutions in which the blood is collected contain citrate, which function as an anticoagulant by binding calcium. So what is the role of phosphorus in that? The addition of phosphorus, it alters the pH to promote the RBC survival, and it serves as a substrate for 2,3-DPG production, while as adenine, it helps the RBCs to maintain its processes, it helps the RBC to maintain its integrity, it minimizes the impairment of stored hemoglobin. So coming to the what are the basic steps for transfusion of blood. So first of all, what we basically do, we collect a 2 ml of blood from donor. What we subject the blood is we check the hemoglobin, we check the TLC, DLC, and the platelet counts that I already mentioned. The hemoglobin should be greater than 13 and PCV should be greater than 40%, and the platelet count should be greater than 2 lakh to be a good donor. And it should be negative for hemoprotozoan diseases like Ehrlichia canis, Babesia gibsoni, and Hepatozoon canis. So it should be negative on RBPT for Brucella canis. And next, what we do is cross matching. So I'll be showing you a video in which there is a collection of blood from a donor dog. So the blood is collected from the jugular vein with the blood collection bag, and the needle is provided with the bag. So we monitor the blood collection on this thermopepnol blood collection monitor. What we do, we adjust the volume of the blood according to what we have to collect, and then we accordingly connect the dog. Then we accordingly collect the blood. After the collection, what we basically do, we declamp the site and we put a manual pressure on the site of hemo so that the hemostasis is achieved. So coming, what is the formula for administration of blood? So the formula that is used is, we have to use this, the recipient weight, in that is, if a dog weighs 20 kg multiplied by 85, that is factor, multiplied by the recipient's desired PCV minus current PCV, that is the PCV of donor, divided by the PCV of the donor blood. So this formula assumes that 60 and 85 ml per kg represent the average blood volume for a cat and dog respectively. So the 2 ml per kg of whole blood will raise the PCV by 1%, while as the packed RBCs, 1 ml per kg of packed RBCs will raise the PCV by 1%. So blood should be always transfused with the inline microfilter. As you can see in this picture, there is this special infusion set that is used. It usually has 170 micrometer pores. What they do, they remove the clots and the larger RBCs as well as the platelet aggregates. So blood should be transfused slow intravenously. When you have no venous access, you can try intramedullary or intraosseous, that is done at the trochanteric fossa, while as the intraperitoneal administration is not recommended. It is not recommended because there are high chances of peritonitis and it has a decreased rate of absorption. So when we peritoneally transfuse RBCs, what happens? The 70% of RBCs, they are absorbed within 48 to 72 hours, and these RBCs have a shorter lifespan as compared to the transfusion when done with intravenous or intramedullary routes. So I'll be showing you the video on how the blood is administered. So if we collect the blood from the jugular vein, it is usually back transfused in the cephalic or the saphenous vein in dog. You should never give blood in jugular vein. So what is the rate of administration? So blood is administered slowly or first 30 minutes at the dose rate of 0.25 ml per kg body weight, while as in normovolemic patients, the rate can be increased up to 5 to 10 ml per kg. But if the patients are severely hypovolemic, the rate can be increased up to 20 ml per kg per hour. If you have a compromised patient that has a cardiac or renal compromise, so the rate can be decreased to 2 ml per kg per hour. So blood should be administered within 4 hours after collection, because after 4 hours there will be bacterial growth will start in the blood and it's not feasible to administer that blood. So coming to the transfusion monitoring chart, so before the administration, you should always remember that we have to use Dexona or Evil as an anti-inflammatory for the administration before the administration of blood. So what we basically do, we have this prepared this transfusion monitoring chart. We have to observe the change in the donor within 10 minutes, 15 minutes, 30 minutes, and 45 minutes of administration. We have to look for any kind of transfusion reaction in the patient. That can be acute reaction that can be seen within 4 hours. For example, the patient will be presented with the signs of hyperthermia. A temperature increase will start. If a patient has an initial temperature of 102 degrees Celsius, there will be a 2-degree temperature rise. The temperature will start showing 104 degrees Celsius. So this is classified as acute febrile reaction in a patient, while we have to check for pulse rate, pulse quality, as well as we can check for blood pressure of the patient. If there are any kind of transfusion reactions that are concurrently happening while we are transfusing the blood, we should check if the patient has any kind of hives or tricharia, or the patient is starting to become restless, or it has the signs that it is frequently urinating, or it has hemoglobinuria or hemoglobinemia in urine. So we have to look for each sign within these 4 hours of transfusion, so that we can monitor each and every parameter of the patient so that there is no acute transfusion reaction. So if we are presented with any kind of reaction, we have to immediately stop the blood transfusion and administer the Dexona and Evil to the patient. And after that, if the patient is stable, we can start the blood transfusion again. So you should always remember this thing. Concurrently, we can give no fluid or no treatment with the blood transfusion. We can only give saline with the blood transfusion, because if we give the fluids like Ringer's lactate, it can overcome the anticoagulant property of citrate, and it will start to clot. So the transfusion reactions are divided into four categories. First is acute immunological reactions. Next is acute hemolytic transfusion reactions. There can be allergic reactions. There can be this transfusion related acute lung injury or transfusion related tracheoenterally. These are the important transfusion reactions. So there can be delayed immunological reactions, that is, the patient is presented with the signs like blood in urine. These are the hemolytic reactions that can occur after the transfusion of blood. However, the non-acute, non-immunological reactions that can occur due to volume overload, that can occur due to citrate toxicity or hypothermia or bacterial contamination, that can predispose the patient to sepsis-like condition if you are not using the proper collection method in the dog, or if you are using an open method of transfusion. So there can be delayed non-immunological reactions like infectious disease transmission. So if we are using a donor, if you're not initially screening a donor for any kind of diseases like hemoprotozoa or any kind of like Brucella canis, so we are giving a iatrogenic infection to the patient irrespective of treating the patient with blood. So coming to the component therapy, this is the advanced part of blood transfusion. The earlier part I dealt is usually performed at each and every clinic. So this is the advanced part where a unit of bag, it can be separated into multiple portions that can benefit more than one patient. We have a single bag of blood. We separate it, we make it into packed RBCs, we make it into PRP, we make it into plasma so that a single unit can benefit more than one patient. So component therapy is based on the separation of blood into multiple portions that can benefit more than one patient. So what does separation does? Separation extends the use of unit of a blood to treat the multiple conditions like anemia, hypoproteinemia, and thrombocytopenia from a single donor. We all know that cancer patients, they have this syndrome called as paraneoplastic syndrome. They suffer from anemia, thrombocytopenia, leukopenia, hypoalbuminemia, and coagulation abnormalities. So a single unit of blood can be used for these purposes, like in these patients that suffer from all these elements. So we what we do basically, we have this whole blood, we centrifuge it into platelet-rich plasma, leading to the formation of two units. First is packed cell RBCs, and then we have platelet-rich plasma. Then we again centrifuge it for the formation of the second unit, that is called as platelet concentrate and the platelet poor plasma, that can be transfused in the hypoproteinemic patients, and the platelet concentrate that can be transfused in the patients with thrombocytopenia. So for this purpose, we have this bag system. First is single bag system, second is double bag system, and third is triple bag system. So in a normal hospital, the blood is collected in a single bag system and administered as either as a fresh blood, or we can use at a stored blood at the temperature of 4 to 6 degrees Celsius. For this purpose, for the component therapy, we can use double bag system or a triple bag system. So what is in double bag system? A bag that contains the anticoagulant as CPDA1 and an empty satellite bag. In triple bag, what we have? We have one CPDA bag, one SAGM bag, and one empty satellite bag. We process the components according to the bag systems. So these are basically the requirements for the blood transfusion or blood bank setting. We need to have a blood weighing balance. We need to have a blood centrifugal machine that is used for the separation of components, and we need to have a plasma espresser for manual press. So we collect this blood. Here we are collecting the blood from a jugular vein into, as you can see here, there are two bags. This is commercially a double bag system, and we collect the blood in this bag. So after that, the collection of this bag, what we basically do, we put these into a centrifugal machine. So what we do, we weigh these bags. So we start weighing the bags on this balance. After the balance, what we do, we fold the second bag in the bucket. These are the buckets of the centrifugation machine. We fold these bags and we put the next, what we next do, we put these buckets in this centrifugation machine. So we check the balance of the machine. We have to check the whether these buckets, they swing freely, because what happens sometimes, if there is imbalance in the machine, the bag can burst in the machine, and of all our unit of collection will be wasted. After centrifugation, what we do, manually express the plasma. We take the bag from that and we express the plasma into the secondary satellite bag. After the expression of the plasma, what we do, we seal these bags with the tube sealer that is available at the blood banking units, so that the fluid path is closed. And for this, we also can do what we can do from the blood bag. We can make some pigtails that are used for the serological compatibility for later on. So, coming to the packed cell RBCs, after the unit of whole blood is centrifuged and the supernatant plasma is separated into bags, the unit of RBCs that remains is called as packed RBCs. So it is used same for the treatment of anemia. It can be used in the treatment of anemia due to hemorrhage, hemolysis, or decreased production. For example, in the diseases like bone marrow suppression, or we can give in those patients in which we want to only to increase the hemoglobin, or the patients that have normal platelet counts. So, how do we select that whether we have to give packed RBCs or whether we have to give whole blood? From the recipient, what we do, we check the total plasma protein recipient as well as the platelet count of the recipient. So, if the total plasma protein is greater than 7.5, and if the platelets are more than 2 lakh, so we decide that we should go for packed red cell blood as compared to the whole blood. While as a patient that has both lower plasma proteins as well as thrombocytopenia, we subject the patient to the whole blood transfusion. So, what are the advantages of packed cell transfusions? So, red cells, these red cells that can be transfused in smaller volumes, and the PCV can be increased by smaller volume of transfusion. For example, if we are giving a whole blood, we are giving it at 15 ml per kg body weight, it will increase the PCV by similarly 2 ml of whole blood increases the PCV by 1%, while as 1% of packed RBC increases the PCV by 1%. So this is the advantage of this. And what is more important is when we check the PCV of the packed RBCs after the separation, it should be round about 60 or 70. So we can expect a higher count, higher increase in HB indices as well as PCV indices after the transfusion of packed cell blood. So next are these whole blood derived products. These are platelet rich plasma, and the next is fresh frozen plasma. So coming to the PRP, that is platelet-rich plasma, it's given patients that have disseminated intravascular coagulation, in the patients that have hypovolemia, or in the patients that have thrombocytopenia. So when to give this PRP? So if the patient is having the platelet count below 50,000, that is the patient is presented with severe thrombocytopenia. We don't give platelets to increase the platelet count. We give platelets to prevent the internal hemorrhage in the patient. So coming to these platelet transfusions are most consistently administered to the patients with life-threatening hemorrhage due to marked thrombocytopenia, And platelets with hemorrhage secondary to the congenital or acquired thrombopathia might also benefit from the platelet transfusions. We know the German Shepherds, they have this disease called as Scott syndrome. So in those patients, there has been lot of research conducted that they are administered PRPs regularly to increase their platelet count and to prevent any kind of massive hemorrhage in these patients. So on the right hand side, you can see this platelet agitator cum incubator. So if we immediately do not use platelets, so we have this machine where the platelets are kept at a temperature of 20 to 22 degrees Celsius, and it is continuously agitating, because if we put the platelets in the normal refrigerator, they will definitely they will not survive, and they need a particular temperature of 22 degrees Celsius for their survival, and they need a continuous agitation so that no platelet aggregate is formed. So next, coming to the fresh frozen plasma. So fresh frozen plasma is that plasma that has been separated from the blood constituents within 8 hours of collection from the whole blood. So this plasma, this has a very good advantage that it can be stored up to 5 years. So within the first year of storage, the fresh frozen plasma contains all the circulating procoagulants and anticoagulants, as well as von Willebrand factor, albumin, globulin, water, as well as electrolytes. As the age of plasma increases, so these factors are slowly reduced in the stored plasma. So the indications of plasma transfusion include congenital bleeding disorders, multiple factor replacement, patients with acquired coagulation disorders. It is a support of hemostasis because it contains all the coagulation factors. It can be used in the patients with liver diseases, in rodenticide poisoning. And what are the advantages of plasma transfusion is that it has a long storage time, it has a reduced risk of volume overload, and there is less red cell sensitization. We all know that the antigens are present on the RBCs, so there are no RBCs in the plasma, so there is less chance of red cell sensitization. So sometimes if we can omit the cross match in case of plasma transfusions, but however, if you want that, we can go for minor cross matching for the patients that undergo plasma transfusion. So what is the formula for the calculation of plasma? So the recipient weight multiplied by 4.5 into the desired albumin level we want, subtracted by the what is the current recipient plasma albumin level, that gives the volume of the plasma that needs to be transfused in a dog. So if you so if we are using stored product, we should verify the blood product unit, its size, its number, its expiration date, as well as the donor species, as well as the blood type. So we should first of all perform a visual inspection in the blood bag. We should check for the presence of clots in the bag. We should properly thaw a bag. So how to thaw a blood bag? So basically blood bag is thawed in a water bath of 30 to 37 degrees Celsius. So what we basically do, we put this bag in a water bath, and we check the temperature of the water bath, and then we thaw the bag slowly in the water bath. We should always remember that we should not exceed the temperature in thawing of the bag, because what it will happen that it will cause hemolysis of the blood, while as the factors like the plasma, the albumins, the proteins, or the coagulation factors that are present, they will be damaged by the high temperature. So we should always check whether our water bath is on stable temperature or not. So we should never microwave our products. We should always ideally put it into either a water bath, such as we can what we do, if we don't have water bath, we can fill a sink with domestic warm water, and we should put our bag in a zip bag so that all the contaminating ports that are locked, and we will thaw the blood safely. So this is a video of plasma. This is a video of platelet-rich plasma transfusion in a patient with paraneoplastic syndrome. As you can see, the eye of the patient was presented with eye tumor, and it had thrombocytopenia. It had the platelet counts less than 13,000. So what we immediately did, we transfused the platelet-rich plasma in the patient, and after that, we ideally what we do after the PRP, we check the platelet counts within 1 hour of transfusion of the platelets. So remember one thing, that whole blood should be stored at normal refrigeration temperature from temperature of 1 to 6 degrees Celsius. So blood bags should be stored always in a vertical upright position that gives a blood bag adequate space to breathe. The Ideally the bag should hang to the full air contact. The refrigerated blood bags, if you are using it, they should be mixed by gentle inversion several times a week during the storage period. The temperature stability is very important in this, so we should regularly check whether our fridge has a proper storage temperature. So the whole blood that has been stored should not be stored in the refrigerator. That needs to be openly used, that is frequently used. For example, we should allow the blood bag to breathe, and it should not be used in the refrigerator that has been used for the storage of food and other possible contaminants. I hope this is enough for today's presentation. Thank you, everyone.
Thank you so much, ma'am. Uh, and there are some questions. So, if anybody has any question, they can write in the chat box, and we have received some of them. Sir, Tejpal sir was asking that what formula used for cat and same like dog.
I guess I have said it in the presentation. It is same for cats, dogs and cats, but the factor is 65 for cats.
Okay, ma'am. Then
I
why
will
not to give blood
look
in
at
jugular vein?
this formula. I have shared it again. Recipient weight into 60 for cats multiplied by the recipient desired PCV minus current PCV divided by the PCV of anticoagulant donor blood. So what is difference here is, like for the cats it is 60, for the dogs it is 85, and some books say it can be 90 for dogs as well.
So, ma'am, why not to give blood in jugular vein?
Because what when we see like that the jugular vein has high flow of blood, if we immediately give into jugular vein, we cannot monitor the transfusion reactions in the patient. As well as when we give blood in the jugular vein, it is the largest vein in the body. So when we give blood
So
in the
does the
jugular vein, what happens that we cannot properly monitor the reaction in the blood because it's having the high flow rate as compared to cephalic or saphenous vein.
ma'am, does the blood transfusion is affected by breed?
Does blood transfusion is affected by the breed? No, if we are doing a proper cross match, and if we are doing a proper collection storage, it is not affected by breeds. But if we want to choose an ideal breed for blood collection, so we should always prefer the greyhounds because they have the high PCV and they have high hemoglobin.
Can we transfuse blood having hemoglobin more than 16?
Yeah, we can transfuse blood from a donor that has hemoglobin more than 16. But we need to concurrently see if there is sometimes what happens, the dehydration masks the hemoglobin of the donor. So we need to check whether all other parameters are normal for the patient, for the donor. We had some questions on the page. I guess there were 6 questions. that had
What is
you
the
had sent to me.
what
Okay,
what is the percentage of different transfusions?
what is the?
Percentage of different transfusions.
No, I don't understand. What is this question? What is the percentage of different transfusions? Means what is this? What kind of? If he can elaborate what he means to say, I don't understand. What is the percentage for different transfusions?
How to manage the transfusion reaction?
Okay, I told to we have to immediately stop the blood transfusion, and we should give the Dexona and Evil to the patient immediately. The only thing we can do is that we have to immediately stop the transfusion.
Okay. So do we have facilities like blood bank? What
Okay,
is the
like
preservation? What is the
okay,
preservation time if we collect blood?
okay. We have, I guess, we have banks in India. One is at Gadwasu and another is at Tanuwas. So for the private clinics, I don't think that there will be like facilities like a centrifugation machine or the plasma espresser. What is the preservation time if we collect blood? So it depends on the bag you are using. Commercially, CPDA provides a shelf life of 30 days. And if we use the additive solutions like SAGM, that is saline adenine glucose mannitol, the shelf life can be increased from 28 or 30 days to 42 days. Can we give injection evil intravenous? We can give intravenous injection we have this question how to give blood intraosseous. So it is given at trochanteric fossa. It's not usually accessible in adult dogs, but it can be safely given in the puppies. I guess we had some questions when people had filled this form. We have this question like what are the present scenario and future about the topic in India. So we know that almost every week, if I talk about my personal experience, we see 10 dogs on an average in a week that have this anemia. So if this thing is commercially available, like if more than two or three blood banks still open in different universities, we can start the component therapy and we can use this as important in this. So we had next question like plan to set up a dog blood bank and its cons and pros. So when starting a dog, it's like very difficult to start a dog blood bank because you need a huge investment for starting a dog blood bank. You need to have basic knowledge about the equipment that are used in the blood banking. You need to have the centrifuge, the plasma espresser and all, and it's like you cannot do it on a single basis. You need to have a big project for the banking. So we had please explain the which tests are mandatory for hemoprotozoan diseases mandatory before the blood transfusion in dogs. So we need to check the endemic pathogens like Brucella canis, Brucella Ehrlichia canis, Babesia canis, Babesia gibsoni, or Hepatozone canis in the uh, blood of a donor. So, what are the different types of blood groups in canines and felines? I already told that there are 13 blood groups in canines, while as there are three major groups in felines. So, the next question was blood matching in dogs. So, I already told that we can do major as well as minor matching in canines. So we had one question like, is there any training program being run by Gadwasu for learning blood transfusion? Currently, I don't think there is any program that is run by Gadwasu for learning blood transfusion. Any anesthetic that can be used safely to temporarily reduce bleeding can be used in canines. So
So, actually, ma'am has informed us she is having internet connection issues. So, if you have a further question, just write mail to the Verticos, or you can write mail directly to the ma'am. We will share the mail ID via with the PPT when we will send the mail to you. So, share your queries to the ma'am mails. She will definitely reply you. Okay. Thank you for joining the webinar.